Hi, I'm Gina Hollenbeck. I was on the Hope with Answers project, but today I'm here with the fabulous Dr. Cheng, and she's going to tell us a little bit about her research grant that she received from LCFA.
So nice to see you, Gina. Yeah, please call me Hiying. Yeah, I feel very honored to be here, and I feel very supported by this great organization. So the research I'm doing right now is because I had a lot of lung cancer patients with brain mets. As you may know, at the diagnosis, like around 10% to 20% of the lung cancer patients actually present with brain mets.
Yeah, that was actually my experience when I first got diagnosed in 2015. My doctor thankfully said, hey, you know, lung cancer likes to go to the brain. And so he said, can you get an MRI? And I was like, I don't feel anything in my brain. Like, I don't feel like headaches or anything like that. And he was like, a lot of times, you know, people who have lung cancer have brain metastasis but are asymptomatic. So, yeah, a lot of people have the brain metastasis.
Yeah, totally. Actually, I had a patient with similar presentation as you did. Yeah, she was diagnosed with lung cancer, early stage lung cancer in 2012, and had surgery and then chemotherapy. And then 1 year later, the cancer recurred. So we treated her with some treatment. And then 3 years later, the cancer spread to the brain and had surgery and whole brain radiation treatment and suffered from a lot of side effects from those treatment.
Right.
Yeah, felt extremely tired. So at that time, we analyzed the specimen both from the initial lung resection and also the resection from the brain. So in addition to other changes, we identified a new change, which is a change in the Richter.
Oh, okay. So backing up, you said you analyzed the lung tissue and the brain tissue from her surgery.
Yes.
So how did you do that? How did you analyze it?
So we sent both specimens for next-gen sequencing. Yeah, and then it gave us some reports, and we did a comparison because we want to know whether some changes or some difference between those two specimens make the tumor spread to the brain and also grow well in the brain.
Okay, so the different thing that you found in the brain, did you say that was called Richter?
Exactly.
Okay,
yes.
okay. And so did you find this in any other people or just this one patient?
Yeah, because the previous study suggests that this may be an important gene involved in the cancer spreading to other places of the body. So we wonder whether it is also important for the cancer spreading to the brain. So we collaborated with the other groups and analyzed more than 10,000 specimens.
Did you say 10,000?
Yes, 10,000 patients.
Wow, so 10,000 patients you analyzed and you found the Richter?
Exactly, yeah. We found more Richter changes in the brain in comparison to the tumor in the lung or other sites. Yeah.
Wow, yeah. That's so amazing that you can find, you know, something else. So there's a potential that with brain metastasis, you may have found a new target. Is that what we're thinking?
Yeah, we hope so, because as you know, traditionally we treat people with cancer spreading to the brain with either surgery or whole brain radiation or other radiation treatment.
And whole brain can be scary for a lot of people. In fact, that's one thing that I'm always like, I want to stay away from whole brain radiation. I'm scared of that. So there's side effects.
Exactly, yeah. I see so many patients with brain mets. So we do feel the pain, the frustration from the patient and their family. I also feel their kind of a determination, try to fight this dreadful complication and try to live a longer and happier life if possible. So we have always tried to find effective and tolerable treatment. And as you may know, for some of the targeted treatment, now they may be able to kind of like overcome the barrier between the brain and the blood and enter the brain, like the one you're taking, right?
Right, targeted therapies, we get resistance, and a lot of times that's the first place that we show is we get brain metastasis. And so this is so exciting because when you have brain metastasis, you also are a lot of times eliminated from clinical trials. And so if we can find ways to target what's going on in the brain, I mean, that could help so many of us, patients like me. So thank you so much for what you do. That's why you're just an amazing rock star, and that's why research is so important.
Yeah, thank you so much. And also other patients and the family. You guys are so supportive, and also LCFA, so supportive of kind of like research. Yeah. It's not easy, but we have to do it. And we also feel kind of like excited, very motivated when we see there may be hope to fight this complicated, condition, and maybe we can improve the patient's quality of life, and even maybe we can try to prolong their life.
Thank you so much, Dr. Cheng. We appreciate you being here.
Yeah.